I welcome you all to this new edition of our trainings and seminars. I am Dr. Abdulaziz Kolaole, the CEO, Leading Care Integrative Medicines, the CMD, Leading Care Academy of Natural and Islamic Medicines. Reinventing Hypertension, a blood pressure symposium. There is need for this type of seminars and health talk at the moment because the news are everywhere on the social media and on papers. We need to save ourselves and our families from life-threatening diseases. In fact, as we all know, there are persistent rise in the rate of persons that were ill and healthy with no signs of any illnesses, just hear that they slumped and they died, sudden deaths. And generally, the risk factors for this type of ailments are many, and one of them is hypertension. Reason we have to discuss, or reason we are choosing to discuss about hypertension at the moment. Hypertension. In this symposium, our objectives, so in this video, I'll be talking about the major definitions, what you need to know, and the determinants of hypertension, therapeutic windows to curing hypertension, tips on getting accurate hypertension diagnosis, especially how to interpret and understand the systolic and diastolic measurements. Definitions. Blood vessels. We all know blood. Blood is everywhere in our body. It moves around, circulates through our body to deliver essential substances like oxygen and nutrients. We're talking about blood vessels, but here we are going to talk about blood vessels, blood pressure, and hypertension. We're talking about blood vessels. That is, we all know blood. Vessel is a container. Blood vessels now are the blood containers where we can find the blood in our body. Take, for example, as you can see now, you can see artery, you can see vein, you can see capillary. So these are the three blood vessels that we have. And you can also see how the capillaries connect the vein to the arteries. So these are types of blood vessels. So we have three types of blood vessels: the arteries, the capillaries, and the veins. So while arteries carry oxygenated blood away from the heart to be delivered to the rest of the body, the organs in the body, veins returns the blood back to the heart and the lungs. So let's get moving. Blood pressure. We're talking about blood pressure. It's the pressure of the force expected from the wall of the blood vessel as it pumps out blood from the heart. And this mechanism is as simple as, why if you want to measure the BP, we need the machine and a cuff. So when you connect, or when your nurse or your doctor connect the cuff to the mercury, that is the mercury gauge, and pumps it. The cuff is inflamed and it blocks blood supply to the arm, especially the area below the cuff. That area, that below the cuff, that is where we place the stethoscope. So as before you start reading, as the nurse or the doctor releases the valve of the bulb to allow the cuff to deflate, by the time it pumps the cuff will inflamed. So as it's releasing the valve, the cuff will start to deflate. So now he or she will listen to the sound through the stethoscopes on the lower parts of the cuff as the artery opens. So it is the artery, the blocked artery by the inflamed cuff. That is, the artery will open. So as the artery opens, so now you'll be listening to the sound as the artery opens to allow the blocked blood to flow again. The sound that you will hear as it flows in the artery and it stops, that is where we get the systolic and the diastolic. And for instance now, the systolic is the maximum pressure of the blood during a single heartbeat, while the diastolic is the minimum pressure of the blood within 2 heartbeats. So usually systolic is the one up, diastolic is the one down. But don't let me go too technical on that. So blood pressure expressions. You hear something like normotensive. They say somebody is normotensive, that is, the person has a normal blood pressure. At the same time, the person, someone that has normal blood pressure might be misdiagnosed and said to have hypertension. That is what is called white coat hypertension. In a situation whereby you measure your blood pressure at home, it will be normal. At the time you get to the clinic or the hospital, when they measure it, they tell you that it is abnormal. When you get home the same day, in the afternoon, in the evening, you measure it again, you get a normal result. So that person is normotensive, but is suffering with what is called white coat hypertension. White coat hypertension is when you get to the clinic or the hospital, you are detected to have hypertension, while at home you are not having it. On the flip side is the masked hypertension. At home, you measure it, you have hypertension. It is abnormal. On getting to the clinic or the hospital, when they measure it, they tell you your blood pressure is normal, and we have hypertensive, which is an abnormal blood pressure, and we have, hypertensive is higher, while hypotensive is lower. Now, hypertension is a condition in which the force of the blood against the artery walls is too high. No, as I said earlier, as the cuff is pumped, the cuff will be inflamed. As the valve is being released, so the cuff will start to deflate. So the blocked blood in the artery will now start to flow and start to pump through the artery. So as they are pumping now, so how do we determine is it normal or abnormal? Hypertensive, hypotensive, or whatever. So hypertension now is the condition in which the force of the blood against the artery walls is too high. Now, we have types of hypertension. We have essential hypertension and secondary hypertension. The essential is also called primary hypertension. It is called primary hypertension when there is no any significant cause of the hypertension. That is according to their definition. Meanwhile, the essential hypertension that is tagged to be the type of hypertension that has no any specific cause, has a great cause. In fact, that is what we are going to focus on in this talk. So why the second type is the secondary hypertension is the type that has a specific cause. For instance, it is caused by a heart damage, kidney damage, liver, spleen, and the likes. At times, it can also be as a result of pregnancy. So these are the types of hypertension. Now, usually, hypertension is defined as a blood pressure above 140 over 90, and is considered severe if the pressure is above 180 over 120. How true is this? Let's go. To know the severity of hypertension, study the following. 90 over 60 millimeter of mercury to 120 over 80 millimeter of mercury is normal hypertension. If you have any measure, any reading that falls in this range, you have normal hypertension. Let us note here, most of hypertensive patients around, let me say, about 18% of people with hypertension are told they are normal. 18% of people that have hypertension in the hospital, at the clinic, they were told they are normal. While about 24% of hypertensive patients that you hear about, they are not hypertensive, they are normal. You can see the irony of the case, of the diagnosis. You get to the hospital, for instance, if you're having white coat hypertension now, on getting to the hospital, they say, it is high, it is high. They just give you drugs, go and start using it. And in the real sense, you are not hypertensive. So in the case of the masked hypertension, when you get to the hospital, they measure it, they say you are okay. Meanwhile, you are hypertensive. That is why a single measurement is not good enough to be used to diagnose a patient to be hypertensive. So that's the meaning of that's the explanation of what I said, that about 18% of people with hypertension are said to be normal, while about 24% hypertensive patients don't have hypertension, according to them. So now, if you have anything 90% or anything 90 over 60 millimeter of mercury to 120 over 80 millimeter of mercury, you have a normal blood pressure. So while 120 to 180, as you can see, you are pre-hypertensive. 140 to 159, mild hypertension. 160 over 100 to 179 over 109, moderate hypertension. 180 over 110 and above, that is severe hypertension. This is the normal reading to know the severity. And one thing about this thing is that in prescription, you have to be precise. There is what to prescribe precisely for a pre-hypertensive patient, different from a mild hypertensive patient. Not to talk of the moderate or the severe hypertensive patient. So if a patient is pre-hypertensive and prescribe mild hypertensive drug to that patient. It might work, but it may take longer time to be corrected, and that may cause some other damages to that person. Likewise, the person that is normotensive, that has normal hypertension, normal blood pressure, and you assume that person to be pre-hypertensive or mild hypertensive, that you prescribe drugs. That is, we are going to cause havoc in that person's body. So that's the essence, that you need to know these things. And mind you, the reading, most of nurses around, or even some doctors, they just take note of the systolic, neglecting the diastolic, that is the figure below. And the figure below, that is, for instance, take 90/60. The 60 below is telling us more about the organs in our body, the heart, the liver, the kidney, and the likes. For instance, if you have 90/40 now, you can see that the 60 has shifted downward. So it means it is telling you that something is going wrong with your organs that need to be investigated. For instance, if you have 120/100, that's problem. You might not have problem with your blood pressure, that is, but you are having problem, or you are about to have problem with one of your organs, either the heart or the liver or the kidney or the spleen or any other thing, and the likes. So let's move on. So, because I don't want the video to be more than this, please don't forget to subscribe our YouTube channel, Leading Care Academy and Clinic, and you can contact us to manage your hypertension, or to know more about hypertension,